Hello, everyone. My name is Sarah Hermson. Thank you for logging in for today's webinar. Today, 2 weeks ago, we had our MIPS webinar overview. Today, we are digging deep with MIPS using the EMR from a MIPS perspective. Please type all of your questions into the Q&A section of this webinar, and we will respond to them and send the questions and answers out after the webinar. So right away, I'm going to kick it over. We have a lot to discuss today, so I'm going to kick it over to Annalisa Donahue, who will walk you through this amazing presentation.
All right, thank you, Sarah. Hi, everyone. I'm Annalisa Donahue, and I'm one of the performance managers here at TriArc. I know I work with more than about 35 of you directly, so if this is the first time you're hearing my name, hearing my voice, thank you for joining in today, and if you're one of my practices, hello. I'm really excited for our conversation today since we'll be looking at our EMR and really honing in on your efficiency when it comes to our MIPS requirements that we need for 2019. So I'm really excited for this. And to be a little bit of a background on me, and again, this is more for if this is the first time you're hearing my name. I've been working in the healthcare realm for the past couple of years, and I received my master's in 2017 focusing on health communication. So I really love this world and really trying to make it more efficient for everyone across the board. So earlier this year, I started working more on the MIPS specific side of things with TriArc. So with that said, we're going to go ahead and dive in a little bit here into our MIPS for 2019. Okay, and here's our agenda for the day. We're going to start out with a little bit of a high-level overview of our MIPS, and then we'll be discussing some of our quality measures that we're going to be hitting today, as well as some of our PI or promoting interoperability measures. And then I'll wrap everything up with a little recap, just some key reminders to keep in mind as we're moving forward with the rest of the day and the rest of the year, really. So just kind of some things to keep in mind. So our MIPS for 2019. First off, what are MIPS? If this is the first time you're hearing MIPS, that's okay. I'm going to be kind of thorough with this as much as I can, but for a lot of us, we might already be familiar with what MIPS really means. It's really just our merit-based incentive payment system through CMS or QPP, our quality payment program. So it's really going to hone in on a lot of our Medicare payments and that side of things. So this will ultimately reward you as our value-based outcomes instead of a couple of other measures that we've been working on in the past few years. So value-based in healthcare is really coming to the forefront with these. So some of you listening might be a part of our advanced alternate payment models or APMs. So some of this will apply to you absolutely, but for most of us, this is going to be a general MIPS conversation. We know that our performance for MIPS 2019 is achieved by these 4 bullets here. We've got our quality dashboard, our promoting interoperability dashboard, and our improvement activities and costs. Today, I'll be really focusing a bit more on the first 2 bullets here, our quality and our promoting interoperability dashboards. As you can see, these are a really significant chunk of our MIPS scoring for 2019. So your percentages, depending if you're a part of an ACO or not, might fluctuate. But for the purpose of the presentation today, I really wanted to talk about both the quality dashboard and the promoting interoperability. So we're going to hit a lot of measures that specifically speak to those 2. And then the most important part of this slide and really the presentation is, why does this matter to us? You know, I know it can be a bit strenuous at times going through some of our MIPS, trying to get all of these clicks. When do you have time in the day to do this? But this really comes down to an individual and systemic system of really focusing on our improvements overall in healthcare, which in turn, you know, will really improve access to health information for patients and ultimately reduce cost of care for everyone. So it's also kind of shifting from meaningful use to value-based outcomes. And for my providers out there, we're really going to be focusing on our payment increases. That's the goal. And also trying to avoid some penalties or reductions with our MIPS 2019 scores. So before I really jump into our measures, if you've not checked out your eligibility status for MIPS 2019, go ahead and do that on the QPP.cms.gov website. You're going to punch in your NPI here and check the years for all years or for 2019, which is what I would recommend. So if you've not done that, go ahead and get that done as soon as possible. I like to provide a lot of my practices with a couple different recommendations when you're going through your quality measures. You know, Triarch is actually certified in 25 quality measures, which is quite a bit. And that gives you a good amount of opportunity, regardless if you are a general practice or if you're a specialty practice out there. I know we've got a good mix of both. So with all of our measures, you know, you really get to pick and choose what's going to work best for you. So with that said, try to keep in mind, you know, measures that you know you can attest for that really make sense for your practice. And if you're having trouble reaching that, go ahead and talk to your performance manager if you have one, or talk with your staff. See what's an easy way to really start focusing on some of these measures and hone in on those percentages and get as many points as possible. Another point I'd like to make sure you're aware of, in the quality dashboard, we do need at least 20 patients minimum in the denominator. Some of you, if you go ahead and look at your quality dashboard, and you'll see on the right-hand side of the column a little triangle with an exclamation point in there. If you hover over that, it's basically our system saying, hey, you need at least 20 folks in the denominator, otherwise you're not going to be able to test for this. So as you're choosing measures, specifically quality measures, make sure you're choosing options that will really give you a good amount of patients to work with. For 2019, we need 6 quality measures to attest for. One needs to be a high priority. And at the end of the day, pay attention to your patient demographics. You know, we're going to talk about that a little bit when I go through my whole entire workflow with my practice patient. You'll see what I mean there. And then, of course, if you're a Q-Pro or Q-Complete, I recommend meeting with your performance manager on a monthly basis. And if you have any questions or concerns, if you have a performance manager or not, let us know. I have my email at the end of this presentation for you today, so you have my contact information. And then for those of you who don't know, you can find your dashboards in our EMR system under Reports, MIPS Dashboard, Quality Dashboard 2019, 2019 PI Dashboard, and you want to keep an eye out on both of those. But again, I know some of you might be a part of an ACO, you might not be utilizing both of those, but just so you are aware of where they're located. So today's standard office visit, we'll go through a couple of things here. First off, these are a lot of the quality measures that I'm going to be talking about today. As you can see, we've got a good chunk here. We've got about 8 of them that we're going to be focusing on. At the end of my visit today, our patient will increment for all of these. So as you can see, we have our influenza immunization, we have our pneumococcal vaccination, BMI screening and follow-up, high blood pressure screening and follow-up, depression screening, tobacco use cessation, and then our favorite, documentation of current medications in the medical record. A lot of us really love this measure. We know it fondly as our high priority measure that a lot of us might be utilizing this year. I know some other practices out there might be utilizing some WHO's or COO's as your high priority measures. But I know a lot of my practices that I work with are utilizing this one, so we want to hone in on that one, and I really wanted to clarify that because it can be a bit tricky. Now for our PI measures that we'll be discussing today, we're going to focus on e-prescribing and then our supporting electronic referral loops, both by receiving and incorporating health information and by sending health information. So those two specifically have been a bit difficult for some of our practices out there. So again, I wanted to spend some time with those. And then our providing patient access to their health information, which is actually where I'm going to be beginning our presentation today. And this starts right away in our patient registration. So I've got a new patient coming in today. This is how I'm going to access my patient registration screen. On my dashboard up here in my EMR, I'm going to go ahead and select new patient. That's going to be that hot button up on the left-hand side that you see there. And of course, you do have the option to customize your dashboards and put your buttons wherever you find they work best for you, but I've got mine on the left there. When I open up my new patient screen, I'm going to see that my patient code is going to be automatically tabulating into that system there. So for example, we have 1361. That's going to be my patient's code. It's going to stay like that. So that's automatically populating for you. I'm going to make sure I put in my patient's date of birth and gender, and their contact details, especially their email information, which I will hit on in a bit more detail momentarily. Likewise, I'm also going to want to incorporate their pharmacy and referral information because that will also play into some of our measures that we'll talk about later on. So this is really the beginning of all of our MIPS processes that you really want to keep in mind as we're moving forward the conversation today. So I have my new patient coming in today, Mr. Gordon Ramsey. I've got his picture up there. So when Gordon comes in today, I'm going to go ahead and make sure that I enter in every piece of information I can for his new patient record. As you can see, I have his address, I have his provider information, his occupation, master chef, of course. I have his pharmacy, and I also have his account number pulling in there as well. Anything that has an asterisk, I want to go ahead and make sure I include. But I'd really like to direct your attention over to our box, which says contact details. I have a phone number in there for Gordon, and I went ahead and I put in an email for Gordon. That's going to be the biggest piece of the puzzle in this registration process to really hit our promoting interoperability measure of providing patients access to their health information. So I'm going to go ahead, enter in his email, and if I'm registering him for the first time, I'm going to select Send Patient Portal Invitation and API Activation. What that's going to do is it's going to tell our system, hey, we have an email in for this patient, we're going to go ahead and get them activated. And this is something that you can always go back and edit in the Modify Patient screen if they ever need to change their email, if they just get an email, whatever the cause may be. You can always find that in the New Patient or Modify Patient screen. Now, it's not always this easy, as we are well aware. We often have patients who might not have an email coming in, and that's okay. We have the option to quick activate, which I'd like to talk about momentarily here. But before I do that, you have a couple different visual cues that will really help you determine if a patient has access to the portal or not. Because again, what's the point of going through this workflow if they're not going to have an email provided into the system? So I've entered in Gordon's information. He's on the left-hand side here. I've got that little envelope icon with the lockbox highlighted in red here for you. That's on the right-hand side of this picture. That's going to tell me, okay, he has access to his email portal. That's great. It looks like I probably have an email set up for him. We're good to go there. Just a quick cue for that. I can also see in Modify Patient on this highlighted box here where it says portal status activated, you see our little icons and API status activated. That's another way that I can go into his system and see if he has that email or not. My other practice patient, Tobias Funke, on the right-hand side, just for comparison, does not have his portal set up, and I can see that through two different ways. First, just on his patient demographics screen, I see my little envelope icon, and it has the do not enter warning on it. If I try to do anything with that, it won't let me because he doesn't have a portal activated. This is another way I can also look into his modified patient too to see if there's an email in his contact details. It's going to tell me his portal status activated and invited or not invited, which we can see here. So just for a little bit of a comparison. And this kind of delves out those icons just a touch more. You can actually send a patient message if they have that little lockbox. You can send a secure patient message to the patient that will get into their patient portal from their patient demographic screen. Or if you try to do that, you're going to get a warning that says, hey, the patient doesn't have an active portal, okay? Now, we have two options when it comes to activating a patient portal. The first that a lot of you might utilize is going into our modified patient and clicking in that portal status, not invited, where you see that here, I have it circled. After I've entered in the email, I'm going to click on that icon. And then I'm going to see my portal account screen pop up where I'll want to hit send invitation. And then step number 3 on the right-hand side here, I'm going to go ahead and see a confirmation. Yes, the invitation to patient has been sent. Great. So that's pretty easy. However, it's not always like that. We have patients who might not be tech savvy, who might not want to share their email, whatever the cause may be, we can still have them increment for this measure. And you're going to do that through this second option. In Modify Patient, if you click on that little portal icon again, I have it circled here, Click on that and then click OK, where we see a little message pop up that says patient does not have an active portal account, no portal messages may be sent. Click OK there. It's going to take you to our portal account screen again, but this time go ahead and hit Quick Activate. Once you hit Quick Activate, it's going to check with you. You sure you want to activate the patient? Say yes. And then on the right-hand side of the screen here, step number 5, you have the option to either print or send an email. If they did provide an email, you can quick activate them too, if that's easier for you. You're going to send them this information, which is essentially their login credentials that they can go in and change if they want. But once you've done this, printed it out, sent it to them, they will have an active portal account. So you've done part 1 of the providing patients access to their health information measure. We're going to focus on this measure when we come back. Towards the end of the presentation, once we're sending out the Generate CDA, I'll talk about that. So just kind of keep this part in your back pocket for now, because we're going to keep moving on. For most of us, after we have registered a patient or modified anything in their patient screen, we might be taking them back to the exam room to go ahead and look at their vitals and screen them for some of our measures that will be honing in for us. So for example, I went ahead and started punching in Ramsey's blood pressure. I also asked him about his weight, height, all of that good stuff. As you can see on our blow-up screen here on his blood pressure sitting, he's at a 150/100. Typically, we want to see more of a 120/80. So that tells me, okay, he's going to have an elevated blood pressure. I want to keep that in mind when I'm entering in his history and other pertinent information. And I'm going to be wanting to focus on that because this will qualify us for a couple of our BMI and blood pressure measures. Our screen here in Vitals really gives us a wonderful opportunity to say quickly, okay, this patient has an elevated BMI, or an elevated blood pressure, or maybe they're underweight, they have a low BMI. You're going to get warnings whenever the patient falls out of the normal ranges for either of these, which is definitely something you want to pay attention to. After we've entered in patient vitals, you have a couple different options here. Some of us might just go ahead and start entering in patient history, but others might want to see if the patient has any screenings that would be pertinent specifically to them. So say, for example, when I was registering Gordon or making his appointment, he said he had been feeling down and anxious lately. So that tells me I might want to utilize one of our screening tools that we have built in our system, and I'll show you how to access that. So for this, I'm going to utilize our depression screening PHQ-2 screening tool, which will really feed into our depression screening and follow-up measure, which is a part of our quality measures. And to locate that, I'm going to go ahead and on our main dashboard, select Go, Screening Tools, and then at PHQ-2 Survey. You're going to see that at the bottom there. Just quickly too, you're going to see all of our other screening tools. We have them all living in this part of our EMR. We've got quite a few options to choose from. So for example, you might be more of an orthopedic practice. You're going to be living in a lot of the who's and who's. Those are going to be your joint replacements, and your patients will be utilizing a lot of these surveys before and after and they come in to see you. And then we also have our Promise 10 survey as well as our Promise 29. So if you have any questions about what some of these tools are, do some digging and look at this to see if it's something you can incorporate into your current workflow and try to hone in on a couple more MIPS points for you. But so for the purpose of Gordon today, I'm going to go ahead and select PHQ-2 survey. I'm going to see our little two question screening tool for him. And if he answers yes to any of these, he's going to take the more in-depth one. But the biggest takeaway from these is this is the first step of one of many quality measures when they would require a screening tool to be performed before anything else kind of takes place. So once I've had him perform this, I know I can always go back and locate any completed screening tool. And again, it doesn't matter if you're using the PHQ or the Promise surveys or the who's and who's. If you go into view screening tools, you're going to be able to see all of the screening tools that patient has on file. So for example, When Gordon came in on the 24th of July, I can see, okay, he took the PHQ-2 survey, and then he took the PHQ-9, which is the more in-depth version of our depression screening. Let's say he was tested positively for depression, so I'm going to keep that in mind as I'm getting ready to log his history. So before we log our patient history, like I said at the beginning, we want to really take into consideration the patient demographics. So based off of Gordon's age, let's say he's 65, I know that he's going to be eligible for a couple of our older adult measures, meaning our pneumococcal vaccination, our colorectal cancer screening. Based off of his vitals, I know he's going to be eligible for some dietary recommendations and recommendations to exercise, so he's going to hone in on some of our BMI and blood pressure measures. If his visit is between October 1st and March 31st, flu season, he's going to be eligible for that influenza immunization. And then I'm also going to see if he has any tobacco use. And if so, I'm going to make sure I recommend some smoking cessation advice. If you have any questions about any of our measures, quality or PI, check out the qpp.cms website. It does a great job of focusing in on some of these measures, just if you need any specification clarified there. So now I'm going to go ahead and enter in Gordon's history. On the left-hand side of my screen here, you'll see I have health maintenance screening populating. I like to call this health maintenance screening. You might call this category your MIPS items. Whatever you call it, just make sure it's something that you're utilizing from MIPS. I'm going to kind of keep in mind, okay, these are the measures that I know I want to inquire further about and make sure I document. So I'm going to click on health maintenance screening or MIPS items. And as I'm entering in this information, I'm going to make sure I include that occur date. None of your measures will increment without your occur date. So please pay attention to that when you're entering in these items. As you can see here, I have his full history screen. I am in his health maintenance screening category. You can see I've built all of those out. And what I'm gonna do is I'm gonna double click on his health maintenance screening item, and it's gonna populate into his record in blue here. So for example, at this point, I've entered in influenza, pneumococcal vaccination, encouragement to exercise, recommending dietary changes, etc. On the right-hand side there, you're gonna see the occur date. That is the most important part of entering in these codes and items. If you don't have that occur date, 9 out of 10 times the measure is not going to increment, because a lot of them are based off of a time frame, and you just need to make sure, hey, when they were in for this encounter on July 24th, we did ask them about that. So be sure you are entering in the occur date every time you enter in a new item on their history. Another thing I'd like to mention about entering in items via our history is, you can enter in each item, you can enter in the occur date, any comments or notes that you feel is pertinent to each item. You also want to check from time to time our little section down at the bottom of our history. You can see that's on the bottom half of the screen here. I've highlighted our tobacco cessation counseling, and you're going to see our SNOMED is highlighted here. I have that smoking cessation advice. From time to time, I highly recommend making sure you have the SNOMEDs built in. Some of us might already have these built in, others might not. If you're missing any SNOMED code there, or a CPT code or MOIC code, depending on the measure, and you're seeing that these people are not incrementing, you might be missing a code there. So you always want to double check that, because this is essentially what's going to pull in the patient to your dashboard. You want to make sure these codes are here, and so it's really speaking to the system. So again, I've asked Gordon about all of these things. I have his influenza, exercise, diet, when his last colonoscopy was, when his last pneumococcal was. I do see he's a light tobacco smoker. I'm going to give him that tobacco cessation counseling, and I'm also going to make sure I include in his history, yep, I screened him for depression, and my follow-up, we're going to talk about today at his visit, whether that's going to be through some medication that I might provide him with or some resources. We're going to figure that out for him. So he should be able to be pulling into all of our dashboard measures that I've populated in here. So just a couple of key things to keep in mind when we're populating information into our patient history. Make sure that you have those codes built in. They will not increment unless you have that, as well as the occur date. You need that occur date every single time. So once we have hit a nice save and close after we've entered in this information, we're going to be taken automatically to our RX Med screen. Our system does that quite nicely for you. It's a pretty seamless transition and saves you a click, which is great. So I'm now going to be focusing on two measures simultaneously. The first being our E-PRESCRIBING, which is our promoting interoperability measure that a lot of us are working on out there. And then a quality measure of our documentation of current medications in the medical record. Again, this is that high priority one we really want to focus on this year. You'll see right away when you get into your RX Med screen that you're going to be able to locate new prescriptions that you might add in for Gordon. You're going to see his medical history, his medication history rather, and then you're going to see any drug allergies that he might have. You can move this over so it's out of your line of view, but you want to make sure as you're prescribing him medications that you have that updated. Now, to really focus on our documentation of current medications in the medical record, say I was going to prescribe Gordon 10 milligrams of lisinopril for his elevated high blood pressure. So I'm going to go ahead and add this into his new prescription section of his RX meds, and you'll see that at the top here. I've gone ahead and I've highlighted that. So I'd also want to include a relevant start date, and then the issue method, especially if we're trying to focus on our electronic prescriptions. I'm going to go ahead and say issue method, ERX. And then I'm also going to want to make sure I have his dosage, route, and patient directions in there. As you can see, I've built that out for duration 30 days, quantity 30 tablets, dosage is 10, route, oral. I've got all of that in there. To reiterate, for the documentation of current medications in the medical record, you want to make sure for every single medication your patients have, you have their dosage, route, and frequency built in there. So again, this can help us with both the documentation of current medications in the medical record and our e-prescribing measures when we have the issue method set as ERX. So just kind of keep that in mind here. Say he has some anxiety, I'm going to be prescribing him some fluoxetine as well. I've got his duration, I've got the dosage and route. His pharmacy is pulling in, and again, that's something that is pulling in automatically after I've entered it in from his patient registration at the very beginning. So you can kind of see how this all circles back and really helps us understand the flow of everything that we're doing. For the medication reconciliation that we need to perform in the documentation of current medications, you'll want to go ahead and navigate to the medication history. And again, this is the bottom section of our patient RX meds. When we're doing that, we'll click on that little pill bottle icon that you see in the middle there. That is our medication reconciliation. And our pop-up is going to come on over our new prescriptions and our medication history. It's very hard to miss. If the patient has provided me with a list of medications, we wish they did that more, right? I'm gonna go ahead and click that. And then I'm gonna hit, yes, I performed this reconciliation today on July 24th. And then I'm gonna do a save and close. So once I've done that and I've made sure that all of my patient's active medications include the dosage, route, and frequency, and this does take into consideration any and all prescriptions, anything over the counter, any vitamins, any supplements. As long as I have all of that information in there and I've reconciled it, we should be good to go in that measure, which is fantastic. It's just when we have patients who have a lot of medications, it takes a bit more time. So just something to keep an extra eye out for. For the actual e-prescribing side, when I've hit the method of issue as an ERX for some of the new prescriptions I'm going to be giving Ramsey, I'd like to go ahead and then hit my issue RX. My electronic RX review is going to pop up here. So say, for example, I'm prescribing him 20 milligrams of fluoxetine. We're going to try out a 30-day dose of that. This is going to pull in my provider information, his patient information, as you can see there, and his pharmacy information, which again pulls in from his patient registration. If this pharmacy accepts electronically received medications, he's going to increment for us after I hit that issue RX button. One thing I'd like to note on this e-prescription measure as well is we do have the option to take some exclusions here, and I'll dive a bit deeper into what some of our exclusions for 2019 really looks like, especially when we're talking about the promoting interoperability measures. But for this one specifically, if you live in an area or your practice is in an area where you don't have a pharmacy that will accept electronic medications within 10 miles of your practice site, you can choose to take this as an exclusion for 2019. Likewise, if you perform 100 transmissions or less of this e-prescription measure, you can take an exclusion there. So you definitely have some options with that. Okay, so just to pause briefly, we've covered quite a bit thus far. So really, to recap the last 30 minutes of this webinar before we dive into our next half, we've done a couple different things that I really just want to refresh us on. Number one, we've registered Gordon as a new patient. We've included his email and patient demographics for the first part of providing patient access to their health information. We've taken his patient vitals. We've performed a needed depression screening. We've entered in his patient history and documented most of our quality measures there, being sure to include all relevant codes and occur date. And then we just sent off his new prescriptions electronically, and we've documented and reconciled his current medications. So we've hit quite a bit in that amount of time. And as you are well aware, you know how fast this really goes. So we're just going to kind of keep continuing with our general process, but just wanted to give you a little bit of a refresher of everything we really have covered up to this point in time. So what most of us will do next is when we're with Ramsey, we're going to go ahead and hit Create New Exam. This is a button on our main dashboard there. So once I've hit that, I'll be able to see his exam notes. You can also open up a new exam for Gordon by right-clicking on his patient demographics and then selecting your provider and then selecting your exam template. So when you're seeing all of that blue writing on the left-hand side of his picture there, those are all of those exam templates that you can get into. So for today, because this is his first time in my office, I'm going to go ahead and select an initial office eval, and I'm going to go ahead and name this exam as anxiety disorder because he's coming in for a couple different things, but that's one of the biggest reasons. So once I've figured out my exam template and my provider that I want to utilize for this, I'm going to go ahead and just make sure quickly that all of his liquid links are pulling in as they should. So for example, I have it highlighted here and it should be showing up in yellow for you, all of our liquid links. You can see who his provider is, that's Addison Graves. You can see his chart number, again, that's his patient code that was entered in when we created his record in the system. We can see the date of visit. We can see his name and date of birth pulling in. So this is just a very minute snapshot of what our liquid links are truly capable of. When you pull in all of this information, everything that you've done up to this point for your patients should pull in. So for example, his vitals will pull into his note as a liquid link, and his medications will pull in as a liquid link. So some really big things to remember there. Now, as a provider, this is typically where you would kind of go through the note and enter in any diagnostic codes through your DXCPT or Smart DX button. I've highlighted those up on the exam note dashboard there for you. And then once you've entered in that information and everything looks good to you, we can go ahead and move on to our next step, which is going to be finishing up our exam note so we can actually send this over to the patient and complete our cycle on providing patients access to their health information. So do a finish for me there, and then you're going to see your summary of visits screen. It's going to populate if you need to follow up on any tasks and assign them to anyone. If you want to go ahead and double check his problem list, whatever it may be, give this a nice review. And then when you've hit finish, it's going to take you back to this screen. And I'd like to direct your attention to our Generate CDA button up at the top of this dashboard. So again, we are back at our exam note. When we hit that Generate CDA exam button, our Generate CDA screen is going to pop up. This is very important for our PI dashboard overall. This is where we're going to want to make sure we are able to send this summary of care over to the patient. So number one, make sure that the patient email has been included or that they've been quick activated prior to this step, otherwise it won't work for you. When you're looking at this generate CDA screen, make sure it says summary type ambulatory. Make sure you have your date and your exam pulling in, because that's what's going to pull in all of those codes and help them increment for you. And then any other purpose of use or other tabs you want to select here. Once you select everything and it looks good, you want to go ahead and hit Portal and API under that Send to Patient button that you see up at the very top. This is really what's going to get this over to the patient portal. Another thing I'd like to mention too before moving on is this does need to happen within 48 hours of the exam opening in order to increment. Otherwise, you will have done all of this and your patient might not increment to your dashboard. So really try to focus on that 48-hour time frame. So once we've sent out that CDA to the patient, we're going to be good to go with that whole measure of providing patients access to their health information. So we've really come full circle on that one, which is great. We're going to talk about some of our other PI measures now, specifically the supporting electronic referral loops. Of course, we have two sides to this coin. We've got the receiving and incorporating side, and then we have the sending side. I'm going to talk first about the receiving and incorporating because for a lot of us out there, I know this is a big part of what we're really trying to hone in on for MIPS. And again, we can take this one as an exclusion for 2019, but I highly encourage you to do this workflow and really become familiar with it. So just in terms of best practices. So I've got our general workflow here that's been circulating internally for us. It's just kind of a nice parsed out version of what this workflow looks like. But to kind of demonstrate, I'm going to break it down a little bit for us. So the first thing you want to do is go to your main dashboard and select your direct messaging inbox. You're going to see that as our little envelope icon there. Looks exactly like your email. You open that up and then you're going to select the email that you want to get into. So for a lot of us who are incorporating and receiving this information, it's going to be some kind of CDA attachment. When I select my email, I'm going to want to right-click on my CDA email attachment, that tiny little envelope that you see on the right-hand side there. When I do a single right-click, I'm going to get this drop-down list of download, import CDA, import selected file. I'm going to select the second one, the import CCD, CCR, CDA files to patient. And another thing I'd really like to mention on this particular slide is if you go ahead and you get into your inbox, you open up your email, and you double click on that CDA attachment, you're going to get a bunch of HTML text, and that's not something that you want. So definitely just go ahead and do a single right-hand click on that attachment, and then you'll see this drop-down screen. So once we've selected import, we can actually choose to preview our CDA here. This is something that will be helpful, especially for our new patients. And then you'll want to go ahead and preview, continue preview. It's going to ask us to validate the CDA a couple of times. It's just something that will always happen in this workflow, so you're doing the right thing if you see that. So after I hit a continue preview, say I have a new patient coming in, or maybe I don't know if they're new. So for example, everything we've just done for Gordon, let's put that on pause for now. Let's say he has been referred over to me through this CDA. And I'm starting to incorporate and receive all of his information. If I'm not sure he's a new patient or not, I might want to navigate over to my PM screen and log in his information to see if when I type in his name, if he populates. If he doesn't, I'm going to go ahead and assume, okay, he must be a new patient then. Our system will also tell you after you've gone through all of this if they're new or not. But it's always nice to save us a couple of seconds if we can to determine if they're new or existing. So let's go ahead and say, all right, new patient, register from file info. Once I do that, I'm going to go ahead and select import. And then it'll ask me to validate my CDA again. And of course, I want to say, yep, let's go ahead and do that, and let's continue our import. And something else I'd like to reiterate, for this measure, the patient does need to be new to our office within this year. So keep that in mind as you're going through and receiving some of these CDAs. If they're a new patient to you this year, they should increment for you if you follow the workflow correctly. So after I continue import, this should populate for me. I should see the CDA pulling up as a form of clinical information. And you can see I've got his patient information here. I've got my Gordon Ramsay, 1050 Wolfstrip Drive, all that patient information. I have my provider information. I have the referring provider information, Dr. Cordy. I'm going to go ahead and do a save and close there. Provided Gordon is a new patient, my screen's automatically going to say, okay, here's your register patient button. I'm going to go ahead and select that. Once I've selected the register patient, I'm going to want to check that the clinical document was saved successfully. I will receive this little note here. I'll click OK there. Once I clicked OK, I might want to go ahead and check out Gordon's modified patient screen just to make sure everything looks kosher and accurate. This is a good opportunity to add any patient notes if relevant, as you can see there, or just, really make sure everything is right. Add in any information that you might need. So that's a really good chunk of the receiving and incorporating. Now, another side of this measure too is the reconciliation. So when we're pulling in CDA information, we want to make sure we're also able to reconcile the patient's problem, medication, and medication allergy lists. So in order to do that, you can actually double click on the pending clinical reconciliation screen that you might see on the patient demographics there. So to go back, you'll be able to see all of the problem, medication, and medication allergy lists. You can uncheck any inactive medications that you see, any allergies or problems that are, just over with. Then you would hit finalize and accept. You'll see a little note on there that says patient has no active lists when your reconciliation is complete. Now, we've done all of that before the patient even comes in. This is just the information we were sent over, right? So when the patient does actually come into our office, if I click this pending clinical reconciliation button, do a nice little double click there, it's going to take me right away to the View CCD, CCR, CDA screen that you're going to see on the bottom side there. And this is where I'll want to double check everything and make sure that all of my reconciliation is accurate. And then I'll do a save and close to complete that workflow. Now the other side of the coin on this measure, we've completed the receiving and incorporating side. Now we're going to focus on the sending information. So say Gordon is one of my patients and he might have some throat pain from yelling at his patients yelling at his employees all the time. So I'm going to go ahead and refer him out to an ENT specialist who might be able to help him. I'm going to select my direct inbox and I'm going to get in there and create a new message. Once I'm in my email and I have a new message ready to go, I'm going to select a patient from my patient list, and I've highlighted that button there for you. So of course, I'm wanting to send over Gordon's information. I'm going to select Gordon Ramsay. Then I'll be selecting my provider that I want to send his information over to. You can see in your address book all of your patient provider information or practice contacts that you might have saved in there. You also will see your SureScripts catalog. This is something that's updated about every other month, I believe. So anyone you might need should be in there. So you have some flexibility when it comes to tailoring your address book to really what you need it to do for efficiency. When I've selected my provider, I'll be back on the new message screen, and then I'll want to go ahead and select the CDA files button. When I do that, my attached CDA from Summary of Care screen will pop up again. And then I'll want to check summary type, ambulatory summary. I'll have my exam in there, any other pertinent information that I want to include for the CDA, and then I'll go ahead and hit Attach CDA. When I've done that, I will have the option to attach and close. I'll go ahead and select Attach and Close there. And then the last thing I'll do is essentially just send the email once the CDA is attached. You see here in step number 8, I have my provider that I'm sending him out to, Dr. Cordy. I have the CDA as an attachment, and I've done that through selecting the CDA files. And I have my patient information pulling up in on the demographics. You can see that this is specifically for Gordon. So I will go ahead and hit send. Once I've done that, I have completed the loop for sending healthcare information. So that measure is essentially done. So we're good on both sides of that, the incorporating and receiving and the sending. Now, at the end of the day, the biggest thing that you might want to take away from doing all of these MIPS, all of these measures, is make sure to check your work. Otherwise, we might be missing a step here and there. We want to make sure if there are any issues, we can address them as soon as possible so you're getting credit where credit is due. One of the ways in which to do that is at the end of an office visit, you can select our Q checkpoint button, which is located on our exam notes screen. So once you've selected that, it's basically going to take you to a screen that looks almost exactly like our quality measure dashboard. And it's going to run through all of the measures that we were focusing on, and it's going to tell you if the patient will be incrementing in or not. So it's a really great feature if you haven't gone through that and kind of see what it does. So just a quick FYI on that, just to really double check all of our work we just put into. So with that said, our standard office visit is done. Let's say I had Gordon, recommended for a referring provider. I sent him out to the front office. He's been checked out. He's gone. So we had a really good visit today. Now, based off of all of that information on his office visit, I know we were diving into our PI measures quite a bit. So this is something that I'd really like to focus on just for a couple of moments before we close up shop here, because again, this is where a lot of us will be performing most of our patient visits when it comes to some of our MIPS measures for the PI dashboard. So if some of you recall, 2 weeks ago, there was a high-level MIPS webinar by our own Julie Lundberg. And I'm just going to showcase a little bit of that for those of you who might not have been able to attend. So this is our PI dashboard for 2019. If you've attested in years prior, you know it's going to look a bit different. And this is really due to the fact that we can exclude certain measures, and they really gumped some things down and got rid of some measures, which is great. They're making it quite easy for us to take as many points as possible from our PI dashboard, which we love, right? So we have our electronic prescribing, our provider-to-patient exchange, our health information exchange, and our public health and clinical data exchange as examples, right? These are measures that we know we need a 90-day measurement period on. So unlike the quality dashboard, that's for the entire year. For the PI dashboard, we know it's only just our best 90 days that we get to choose. We have some exclusions we can take here. So for example, you see these boxes on the right-hand side, for example, on the E-PRESCRIBING, the health information exchange measures, and the clinical data exchange measures. Those are all opportunities to exclude. So I'd like to kind of show you how that builds out in terms of our reweighting of points. So you'll see the max 10 points, for example, on the public health and clinical data exchange. These are our registry reportings. If you do this, great. If you don't, that's okay. We might want to go ahead and choose to exclude those. So those 10 points that you would have received for fulfilling that will actually be moved up to the provider-to-patient exchange category. And just so you can kind of see what that looks like, I've honed in on our exclusions here. So those 10 points that were in our registry's reporting have been moved up to a providing patient electronic access to their health information. So now instead of the providing patients access to their health information, that was 40 before, now it's 50 because we've reweighted and excluded those measures. We have quite a few options for excluding, which is fantastic. All of these measures on the left-hand side we can exclude. And we do have the option to exclude the sending health information side of that health information exchange measure. We just do not have it in our dashboard quite yet. CMS hasn't informed us what that reweighting is going to look like. So when we have time to attest and we're really going through that, you do need to understand that we can choose to take an exclusion for that side as well. We have a couple of optional bonus points for 2019. Julie's webinar really hit these quite well a couple of weeks ago. So if this is something you want to know more information on, I highly recommend going back to our website and checking out one of our MIPS 2019 webinars from a couple of weeks ago, just so you can kind of see if that's something your practice would qualify for. And then the last thing I'd like to say before I leave our 2019 PI dashboard is that you will be able to do the security risk analysis. You're not going to see it on our dashboard here, whereas last year you could do the drop down and say you had that. You still need that security risk analysis for 2019 in order to attest. So make sure you have that. Make sure you're talking to your IT folks about that. If they've done it in years prior, they should know exactly what we're referring to in our security risk analysis. So just make sure you've got that ready to go for 2019 attestation. So in summary, the measures we met in this office visit are fantastic. We've hit quite a few of our quality measures. We've hit about 8 of them, including 1 high priority, which is great. We've also hit all of our promoting interoperability measures, like our e-prescribing, which was done through our RxMed screen. We hit our health information exchange measures, which was done through our direct messaging. And we've hit our providing patient access to health information, which is the first thing we did in registering the patient by adding in their email. So we've really come full circle, and we've hit so many different measures based off of the patient demographics and his history, and you really have a lot of wiggle room when it comes to some of our measures here. So some next steps I'd like to recommend before I leave you today is to make sure for your quality measures you have at least 6 that you feel you'll be ready to report for next year. You need 6 at minimum. One of those does need to be a high priority. And like I've said throughout the presentation, you know, that might look a little different for some of us out there. For example, who's and who's. For some of us, it'll be the documentation of current medications in the medical record. So really make sure you're focusing on that and getting as high a percentage as possible for those measures. And then for our 2019 dashboard, make sure that you do have the ability to allow for exclusions. You can take as many exclusions as you need. And then these are just some that you can exclude for, and those will be redistributed to the rest of the dashboard and will really help your overall score. And we do have some optional measures if you want some further information on. I highly recommend going to our website there. And then the last thing for the 2019 PI dashboard, make sure you have your security risk analysis. I'd also like to recommend that you check on your dashboards regularly, and again, that's through your reports MIPS dashboards option on your EMR. I know some of us out there meet with our performance manager once a month. If you have a chance to go in there maybe every other week in between, that would be great, just to make sure if there's an issue, we can catch it early. And then good news, our 2018 MIPS scoring is actually now available to review for 2020. So if you have any questions about that, please feel free to reach out. And then for information on this webinar and specific notes pertaining to this webinar, and then to view past webinars, go to our triarchealth.com website so you can see all of that information. We have some really great resources that we'd love for you to check out. So here's my email, that a.donahue@triarchealth.com. Please feel free to ask me any questions that you might have regarding this webinar or anything pertaining to MIPS. And then if you have anything more tech related, I have our support information on there as well. So thank you so much for your time. Really appreciate you stepping in for today. And again, let us know if you have any questions, and good luck with the rest of your MIPS reporting for this year.
And again, everything will be posted on the website by the end of the day this Friday. So within the next 72 hours, everything will be, this presentation, PDF, the 2018 notes will all be online by the end of the day this Friday. So thank you so much for attending, and have a great day.